Hey guys, how are you all? So today I'm here. I just posted a video today and marvelous response from you guys. Thank you so very much. So I thought that I should make a live video regarding that also so that everybody can listen to that point because that point was really important and that point was related to advanced dentistry courses which everybody want to opt for, right? So right now we all want to learn something new. Dentistry is changing. Everything is getting ahead in life. So we really want to match up the pace. So the most frequently asked question from me from dental students is that which course should we opt for or which workshop which should we opt for in order to go for advanced dentistry courses, right? Should we learn implantology? Should we learn ortho courses? Should we go for endo courses? Should we go for facial aesthetic courses? So that our practice will improve. We should know what others don't know. We should be better than others. So this is what the thought is. So I thought before I'll guide you for that, that who is the best doctor, which is the best academy, and which is the best course. So I want you to learn few basic things. In fact, two basic learnings of my life when I was stuck into this situation 2 years back, and whenever I still feel that I'm stuck into this thing. So I asked myself two important questions and I want you to learn these two important questions. That I want you to ask yourself these two important questions. The first one, before going to any advanced dentistry course, first one I want you to ask yourself is, please understand that you want to learn something which you don't know till now, right? You want to learn something which you don't know till now, but ask yourself, whatever you know till now from your college experience or from any experience you had, uh, do you believe that you know that thing in its best or good possible way? For example, I'll simplify it more. You want to learn endo, right? You want to learn advanced endo. You want to learn how to use endomotor. You want to learn how apex locator works. You want to know how rubber dam works. But do you believe that you know how to perform, how to do a good basic and RCT? Do you know what kind of irrigant you will use? Do you know uh, what is the role of the irrigant? Do you know how does that sodium chloride, sodium hypochlorite helps? You want to go for implants? Do you know that how to give a proper local anesthesia, right? So you should know the basic things. The base of the building should be very strong, right? This is what I ask myself, that do I know everything in a correct manner, whatever I know till now? Yes, you should not know everything before you open your own practice, but at least basics should be really really strong. That will really help. So before you go for those courses, please understand that you have to have your base very strong so that the building should not collapse, right? Similarly, the second learning of my life, that was especially for the people who are about to start their own practice or who just started or who wish to. So before you go for these courses, I want you to access three things in your life. That do you have the platform, do you have the patients, and do you have the armamentarium or investment or money for this? Now let me explain it more. Let me broaden the view. The Simply you have to ask yourself, for example, you want to go for endo courses, right? Do you have the platform? That means, do you have any clinic of yours or any job of yours, any hospital where you're visiting where you can perform those treatment to the patients? So you should have that platform. Secondly, you should have the patients for that. You want to go for implant courses, yeah, please do. But do you believe that you have that much ample amount of patients in your clinic or any place where you can perform that? Because it is really important to apply it as soon as possible, right? Third thing, do you have the money for it? Do you have the armamentarium to buy all those things, physio dispenser, rubber dam, and everything? So I'm not saying you should not go for it when you don't have all these things, but it would be really really awesome that you are going for all those things nearer to the time when you have all of these things. There were so many students, so many friend of mine who went for these courses at the time of graduation, at the time when they never had any jobs or any of their, nobody have their own clinic or that much amount of patients were not there. So they opt for those courses way back, and they still are not applying it because they don't have implant patients, they don't have maybe these kind of patients can pay to them. So it really hurts, it really hurts. So better to go for those courses when you have those things, try to achieve those things. Yes, I want you to learn, you know that I want you to learn all the basic and advanced dentistry, but before you go for advanced dentistry, please ask yourself these two important points, that your your basics are good enough, and do you have the platform, the patients, the money to go for it. And if you have all of this, boom, you have to go for that. So thank you so very much guys for so much of your time. I want you to learn something every day. Dentistry is not a bad profession. Please get this out of your mind. You are into it. It it will just need your time, your blood, your sweat, and then it will give you wonders. So this is what I have learned from my life. So I want you to go for that. Thank you so very much guys for so much of your time, for subscribing my channel, for liking my videos, for liking my page, for following me. I'm really, really grateful to each one of you. Please understand the base should be strong, and do it nearer to the time when you have all the things with you. Thank you so very much guys. Have a wonderful weekend. Thank you.